Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon from Buenos Aires, Argentina. I'm specialized in facial rejuvenation using laser technology. Today I'm going to explain the difference between my technique and the conventional and old technique that are resective. My technique consists in rejuvenating the tissue, tightening the tissue instead of resect the tissue. Let's go to the presentation. Conventional blepharoplasty, complication, how avoid it, how to repair it. This is the conventional resective upper blepharoplasty. If you go to see in the Google, we are going to see many plastic surgeons publish that they perform blepharoplasty with laser, but what really they do is cutting with laser, because the laser can be used with this handpiece to cut and coagulate the tissue, but they don't improve the tissue and then don't tighten the tissue with laser. They resect the tissue. And also in the lower eyelid, this is the incision they perform. They cut the orbicularis muscle in order to pick up and remove the lower eyelid fat pads. And the stitches, and this is a patient was operated 10 years ago on a conventional upper blepharoplasty, but this tire sad look is done because they resect too much upper eyelid skin and they pull down the eyebrow. Also, the cut of the skin in the lower eyelid and the muscle produce this descension, this drop of the tarsal plate with exposure of the eyeball. Here we can see in a short view and how this vascularization in the eye is for the sun and wind exposure. We can see in another way this subject. This is the patient, the same patient that I performed a forehead lift with three small incisions inside of the hair line, that no scar is visible, just 1 centimeter of scar. With this small incision and using endoscopy, I'll lift the eyebrow and the forehead skin is contracted and is adapted and stay in a higher position, and this is long lasting. In the lower eyelid, I perform a full rejuvenation with carbon dioxide laser and also volumization of the malar area. Here we can see in a short view how we improve the patient, and this is pre and post operative 40 days after the procedure. We can see how we improve the change of the look. Our eyes express a plethora of emotion: sadness, tiredness, elderness, and most of the patients after the conventional blepharoplasty say, I look tired, I look sad, but I'm not tired, I'm not sad. But the reason is for the position, for the dropness of the eyebrow and the skin laxity here. Because the conventional lower eyelid blepharoplasty pull down this area and also pull down the eyebrow, and here is the reposition of the tissue. When you look in a magazine, in the television, and you see a nice eyes, you are going to see an oval like this, but when you are going to see an old eyes and tires, the oval is vertical and this is horizontal. And here is when you trace a line from the pupil at this oval, you are going to find that in the whole look, this line is in the third up of the oval, and here is in the middle. Is equivalent from here to here to here to here. We can see how the skin was tightening, how improved the tonism of the auricularis muscle, and in this patient was no need to make a cantopexia or a cantoplasty. The change of the look, the change of the skin, and a full face laser rejuvenation also is done, and the patient have a full rejuvenation. To understand the subject, if when a patient is pregnant, have a big distension of the tissue, but after the delivery, the tissue began to contract, and sometimes is at the same level than before the pregnancy. I think there is only way for doing this, and this way is to abandon the conventional resective technique and to go to the line of the technology. I think it's not easy because laser technology costs a lot of money, have a lot of training, and I have 25 years of training in this procedure. But I hope this is the concept, is tightening the skin. Just is like, I make this picture, is like a screw tightening the ball. No? For this year is the time to change all paradigms, and if someone, patient or medical doctor, you may choose to look the other way, but you can never again say you did not know it. Thank you, William Wilford. I hope you enjoyed this presentation. My team and I wait for you in Buenos Aires, Argentina, and you can make your consultation. Send us a WhatsApp or an email with your pictures, and also what do you want to improve. In my website I have several videos, almost 1,300 videos, and you can see different kind of patients, and you can see the results. And if you have any doubts, please send us your email, photos, and we can help you to come to Argentina. Most of the patients perform their pre-studies in their countries and send us to check if everything is okay. Depending on the surgery is the time of stay in Buenos Aires. Buenos Aires is a cosmopolitan city, it's very nice, at this moment very cheap, and if some patients have 2, 3, 4 days of the recovery and go to see the city, and others go outside to the Patagonia, the waterfall, the north. We are waiting for you. Send us information, send us pictures, and we can keep in touch.